I'm Dr. Athar. I'm one of the junior doctors in the surgery here. Am I talking to 34-year-old Mrs. Parker?
Yes, doctor. I am Sam Parker.
Okay, Miss Parker. I have an understanding that you have an surgery in a few days. Is that right?
Yes, doctor.
Okay. And has anybody taken your bloods?
Yeah, when I came here, somebody took my blood.
Okay. All right. And have you been explained the procedure?
No, nobody has the procedure. That's why.
Okay. Okay. I'll do that for you. Just if you could give me a bit of a recap before we do that, what happened and why did you have to come to the hospital?
Okay. Actually, I had some tummy pain about 3 to 4 weeks back, and I was
Right,
doing
right,
really poorly after that. So I came here. They admitted me for some days, and then they discharged me.
right. And have they told you what you've got?
Yeah, they told me I have got some gallstones.
Right. Oh, all right, all right. Do you have any pain right now?
No, I'm not in pain anymore.
All right. Any nausea or vomiting?
Yeah, sometime I feel nauseous.
Okay, okay. Thank you for answering these few questions. I'm just going to do a quick examination, all right, and then I'm going to discuss the procedure with you. Okay. Miss Parker, do you have any concerns that you would like to discuss with me before I explain the procedure to you?
I actually want to know what's gonna happen during the surgery,
Right.
and is it safe for me to have the surgery?
All right, all right. Okay, I'm going to explain the procedure for you. First of all, before the procedure, we'll be keeping you in the hospital as you're already admitted, and you'll have to skip your morning meal before the procedure. Is that all right?
Okay. For how many days
Okay.
I will be
And
staying in the hospital?
after the procedure, you'll have to stay in the hospital for like a day or two, depending upon how the procedure turns out. All right.
Okay.
Okay. And as you wanted to know about the procedure and is it safe for you? Yes, this procedure is a very routine procedure. We do it every day in the hospital. And since your assessment has already been done, you are safe for the procedure. Now I'm going to explain the procedure to you now. Okay. I'm going to try to use simple terms, but if anything is confusing or if you want to ask me anything, you can do that. Interrupt me and ask your question. Okay.
All right.
All right. So this procedure is basically done to remove the gallbladder from your tummy so that the stones in there don't disturb you regularly or they don't cause pain or vomiting again. All right.
Okay.
What we do is that we give you some medicines to keep you asleep, and then the doctor does a keyhole surgery. Small cuts will be made, all right, one in your middle of your tummy and two on the sides. And instruments will be then used to bring your gallbladder out. Okay, does that make sense?
Okay, doctor.
Do you seem a little low? Do you have any confusions?
Yeah, I just wanted to know if these cuts are gonna bother me later. Like there will be any scar.
No, these are very small cuts and they heal pretty quickly depending upon the patient's condition, but they're not going to bother you much. And there is a chance of having infection or bleeding from them, but we'll be very vigilant and we'll keep an eye on them and deal with them as the situation arises, okay?
Okay. Will they be visible?
No, they won't be because the scars are very small incisions, very small cuts, and after the stitching, they won't be that visible, okay? And there's always things that we can do if they bother you later.
All right, because I'm planning to go on a vacation next month, so
Right.
that was the only thing I was concerned about.
Okay. Those scars shouldn't be a big problem depending upon the location that you're going in. We can discuss this further in detail after the procedure, depending upon the scars about your travel plans. But if you're planning on wearing bikinis or crop tops, I don't think that would be that big of a problem if the surgery goes fine and it remains keyhole surgery. Do you understand that?
Okay.
Okay. Do you have any more questions or should I keep explaining the procedure further?
No, I think you can go.
Okay. Is there anything else that is bugging you?
No, I'm fine at the moment.
All right. And is there anybody else who is here with you at the hospital?
No, nobody was allowed here, so I'm alone.
Right. And after
Six
right after
minutes.
you're discharged, who's going to take you home?
My husband is gonna pick me up.
Okay. All right. I'm glad to hear about that. Anything else that I can do for you?
Mm, doctor, are there any complications associated with the
Yes.
surgery?
Yes, sometimes the surgery can get complicated, and we can turn into an open surgery. And that means that the scars could get bigger. But I'll discuss that with my senior, and I'll get back to you about that. There can also be bleeding from the procedure. Uh, but to deal with that, we'll have blood products ready with us, and we'll have fluids ready with us, and we'll deal with them as the situation arises. Complications can always happen, but we're going to be very vigilant and on our toes about them.
So it
Okay.
means that there is not going to be any complication associated, right?
That's not true. Complications can arise, but depending upon the situation, if the patient feels sick after the surgery, sometimes there can be some discharge from the wounds, but we'll be properly handling those situations according to whatever happens. Okay.
Okay. You
But those
mentioned about some blood
yes,
products, doctor, but I don't
right,
want to go ahead
yes.
with blood products
Why is that so,
because I'm Jehovah's
Mrs.
Witness. We don't accept blood products, doctor, and I mentioned that earlier as well.
Hello, can you hear me, Dr. Kurat?
Yes, now I can hear you. Can you hear me?
Hello.
Yes,
Yes,
can
now
you?
I can.
Okay. So your time is
Okay.
up, but I want you
Okay.
to answer this question. Okay.
Right. I think it was a problem with right.
Unsa, hello. Well, the time is up, Unsa, and I think it will help if you can rejoin the session. Is anyone else having problem with my voice?
Doctor, your voice is breaking in between actually,
Okay.
but it's fine most of the time. But sometimes like it gets off.
Okay. Now it's okay.
Yeah, now it's fine. Now it's perfectly clear.
All right. I'm really sorry. It might be something wrong with internet connection.
Yeah, in the
Uh,
beginning it was like a bit on and off, but now it's fine.
all right. Dr. Unsa, are you there?
Yes, I am.
All right. So last question. I would like your answer, and then we can go ahead about and
Yes.
have a feedback.
Yes, okay. Uh, all right. If you don't, you mean I should continue with the consultation, right?
Yeah, the last question I mentioned about Jehovah's Witness, right? So
Yes,
how
yes,
you are
yes.
going to
Yes,
answer
you
that
did.
question?
Okay. Okay. I respect that, and you're completely allowed to not have blood products if that's what you want. There are a number of options that we can offer you instead of those. Would you like me to tell you about them?
Yes, doctor, sure.
All right. There are some blood products that do not actually contain the main extract of blood. They are like simple fluids. We'll start with those first, and then we can offer you things like plasma, which is basically the fluid from blood, but does not contain red blood cells that make blood the red component. Do you understand that?
Okay.
Would you be willing to have those if the need arises?
Yeah, I'm happy as long as you are not giving me any blood.
All right, all right. I'll make a note about that in my in your file that you are a Jehovah Witness and you would not like blood in elective situations. Okay.
Okay.
Thank you for letting me know that.
Okay, you are welcome, doctor. Okay, okay, time's up. Anybody want to add
Okay.
anything? How do you feel, Dr. Unsa? How was your performance?
I think because when you were putting on the slides, I saw the part about Jehovah Witness, but the consultation naturally didn't go towards that. So I was a bit confused how to bring that up.
Okay. So
And I
actually, you
also
don't
wanted
have
to,
to bring that up. You don't have to bring that up. Just go with the flow. Because in the exam,
right,
not
right.
everybody will be asking you the same question. Sometimes they do deliberately change the scenario to make sure you are not scripted. If patient is not talking about that thing, you don't have to talk about that because you have read it in the script. All right?
Okay, that makes sense. That makes sense. All right, all right. Okay, I have a question in this scenario. Was I supposed to do examination and other past medical history and all that stuff? Because it says pre-op assessment has been done.
Yeah. So yeah, that's fine. You can just mention that I hope your pre-op assessment has already been done. You can just say this line, and after that you can say I would like to quickly examine you as well by the end of this consultation, and then it will cover your examination part as well.
All right, all right. You can now give me the feedback other than these things.
All right. Anybody else wants to add anything?
Can we discuss about any blood loss, like bloodless surgery? We can say to the
Yeah,
patient
you
that I
can.
can discuss with my consultant.
Yes, you can. Good
Okay.
point. And also, one thing that I would like to mention, okay, let's talk about the feedback first, right, Dr. Unsa? Let's talk about your feedback and then we will see how we are going to approach this station in the exam. So when you started, you said your GMC number, that's fine. But you said, am I talking to 34 years old Stan Parker? Do you think it's the right way to, when you are speaking to somebody, is it a right way or you can modify this thing?
I think I can modify this. I was just doing that to save time.
No, don't do that. Otherwise, in the exam, it's not, you don't have to think it's an exam. You should be acting like you are talking to some real person. So if you are saying 34-year-old Stan Parker, it will not look good. So it's better to say like someone who is going to say these same lines in a real scenario. Okay.
Can I say that, am I talking to Mrs. Parker? And then I can ask her age. Can you confirm your date of birth for me?
Yeah. You can say like that, or you can confirm your age, because this is not a telephonic station. In telephonic station, because date of birth is given, so you will be asking about date of birth. It's a face to face, so you can ask her to confirm her age then, right?
Me, please. Okay, okay. Thank you. Okay, that makes sense.
And after that, uh, you started in a right way. You asked me for a quick recap. So for everybody, when we are addressing a counseling station, this was a counseling station, right? So anybody can tell me what is the difference between counseling and history taking station? How will you get to know that it is a counseling or history taking station from outside the cubicle? How you are going to know about it? Anyone?
Well, in the counseling station, the diagnosis has already been made.
Yeah,
So we don't have
perfect.
to focus much on the presenting complaint and stuff.
Yeah, perfect. So in the history taking station, they will be presenting complaint in the task, for example, headache, abdominal pain, or whatever. So if it is a counseling station, you already have a diagnosis. You have to think about counseling station approach. Otherwise, in history taking, you will be doing the history taking first, then past medical history. In counseling station, you will do history, but the history will not be a very brief. It will be very brief. It will not be a detailed history. So for that, the approach is getting a recap first and then asking about current symptoms this is an approach for this station. And like current symptoms mean you are making sure patient is not having anything. And you asked me, Dr. Unsa, that was good. You asked me about history, that was good. Then after that, depending on the scenario, you can ask about smoking, past medical history, and DESA. For new people, DESA is diet, exercise, smoking, and alcohol. So if it is relevant, you can ask. If it is not, just skip it and then mention about your examination and investigation. Because in this station, it was mentioned in the task that pre-op assessment has already been done. So you can just say, I think your pre-op assessment has been done and we have taken some bloods like she did already. So now we are going to talk about the procedure. Today we are going to talk about the procedure, right? So while you are talking to me about the procedure, Dr. Vansa, at many points you were just asking, you were saying, okay, we are talking, this procedure is safe, this procedure is safe. I would like you to say the name of the procedure. Don't keep saying procedure again and again, right? So in the beginning, get her inside. Does she know what procedure she is going to have? So do you know what we are planning for you, which surgery you are going to have? And then she will tell you that you are taking the gallbladder out. I think it will be much easier for you to start your, instead of saying procedure, and then later on telling that, okay, this is the procedure. Do you have any idea? Start from the inside first. And like in all the counseling station, always try to get their insight, what they already know about it. So when you are asking me, do you know which procedure, any idea what we are going to do in that procedure? Maybe she knows about few things. Maybe she knows about what you are going to do. Like maybe she knows something about keyhole surgery in the last visit. Somebody has told her about that, and it will save your time. And then you can go ahead and talk about something else which is in her mind, right?
All right, got it.
So ask about her understanding first, and then I asked you a question: is it a safe procedure? It was a tricky question. Another question I asked you about scar formation. So whenever somebody is sharing some concerns, there is a proper way to answer the concerns. And secondly, it is a safe procedure. Yes, it is, but it can have complications, right? So if you are saying
Right,
it
yes,
is a
yes.
very safe procedure without mentioning any complication, is it a false reassurance? What do you think?
Yes, that comes under false reassurance. You're right.
Yeah. So when somebody, it was a way I was taking you towards the complication. When I asked you, is it a safe procedure? So I wanted to talk about some complications. So there are many ways you can say, you can answer this question, right? I want to hear the answer for this question. I'm going to ask the same question from somebody else, and let's see how you are going to address this concern, right?
Can I answer?
Yes, sure. Is it a safe procedure, doctor?
Well, Mrs. Parker, you see, as with any surgery, there are some complications that might arise. Like, for example, there's a chance that you might develop bleeding or infection. But rest assured, if these complications were to happen, we can do and we can help you out. For example, if you develop any sort of bleeding, we can re-explore it and you can uh, close it off. And apart from that, if you develop any kind of infection, we can give you some medications. Is it
Right.
all right?
Okay, thank you. Right, that is way, but there is a better way as well. So, you know, whenever you are telling some bad things about something or someone, so you can sandwich it within good things. So first of all, you should acknowledge the concern. I shared a concern, you should acknowledge the concern. So there are many ways of acknowledging the concern. It is a very valid concern. You can say, yes, your concern is quite valid, but it normally or usually it is a safe procedure, but sometimes there are some complications associated with that procedure. Do you have any idea about it? Have you heard about these complications? And then let's see, maybe she is having some complication in her mind. Maybe she is concerned about bleeding or anything, or scar formation or anything else. So acknowledge the concern, and then you can reassure. And then, because you are reassuring, but we know that there are complications and we can't give false reassurance. So after that, you can mention about complication. Don't give complication now, and let's see if she is having any idea about it or not. So maybe if she's saying, no, doctor, what complications you are talking about? So same doctor, Dr. Paul, I think. So how you are going to address this? What complications, doctor?
Well, sometimes when we do the procedure, and there's a chance that you might develop some form of bleeding.
Okay.
So
Oh, doctor, do you think I'm gonna die with the surgery, with bleeding?
well, not at all. I mean, if that were to happen, we will be well prepared for it. So for that, we might have some bloods ready for you, or we'll give you some fluids. Apart from that, we'll try to close the wound site as well.
Okay, all right. So another better way. So someone asking about a question which bleeding is not the only complication. There are a lot of other complications. Similarly, there are some other things as well, which the answer is the answer will include a lot of things. So you can summarize. For example, if I asked doctor which complications you are talking about, so you can say, well, it is a relatively safe surgery, but still, like any other procedure, it can have some complication like bleeding, infection, pain, some anesthesia related complication, and some long-term complication. But Mrs. Parker, I want to reassure you that you are in safe hand, and we will try our best to handle these complications. And if anything is happening, we can intervene you. Is there any complication that is bothering you the most at the moment, so that we can start from that?
I would like to add a point.
Yes, sure.
So yes, we can start the discussion of complication. We can say that among the many procedures for this condition, this is a relatively safe procedure. But like other procedures, it also has some complication. And starting with, we can say, infection, and then we can explain the infection. And one more thing, when you ask that whether you are going to die, so I think I should ask why do you think so?
Yeah.
So I should, yeah. So not moving on to my other complication, I should first discuss this concern, then I should move on. Like, so if you know only one complication, that's enough. You can add more. If the patient is asking for other concern, then you can add more complication to that.
Well, I would not say that, because maybe the complication you are going to tell the patient, he is not concerned about that complication, right? You are having an exam, and but in the real life, you are addressing a patient, somebody who is going to have cholecystectomy, and if you are the one who is telling patient about procedure, you should be knowing about complication. Can you please mute yourself, whoever is talking? Okay, so if you are talking about a procedure, the procedure will not be complete without talking about complication. So if you don't know the complication, it is a rule of thumb. Every surgery or every procedure is having few complications, which will be common in all of them. For example, infection, pain, bleeding, scar formation, anesthesia related complications. So you will see these complications everywhere. So after giving the complication, you can say, is there any particular thing, or before starting the complication, if patient deliberately wanted you to talk about complication, you can ask the patient if he wants to talk about any specific complication. There are many complications related with the surgery. Or if you have named the complication, you can ask the patient, is there any specific complication you want me to start with? And then maybe I am going to tell you, okay, start with bleeding or start with infection. Or another complication you can always add is blood clot. So that is also a very common complication. So these 4-5 things are complication for everything. And if you know nothing, at least you can say these things. I would not say start with one thing, because it will waste your time. And if patient is not concerned about infection, or if, for example, patient want to talk about blood clot, but you have not said anything about blood clot, then that part of conversation will be missing, and maybe your time is finished and you will not get marks for addressing the concerns. Any question?
Thank you for this. I was just saying that if, let's say, we don't know about many of complications, like we do know that infection, bleeding, blood clot, anesthesia complications, they are a part of all the procedures. So let's say we are discussing infection with the patient, and patient say that am I going to die with the infection? So I was saying that we can let's say focus on that issue, then we should move forward. So
yeah, that's the different scenario.
Yeah, so I'm just asking about concern-based approach rather than putting the whole script. I was just asking about that.
Yeah, patient is saying that am I going to die with infection, or am I going to die with bleeding? So yes, that's right. You have to address that concern first. So okay, am I going to die with infection? I am asking the same question, right? How will you address?
Well, I would acknowledge that. Why do you think so? Maybe he or he has something in the back of her or his mind.
Okay,
that
so because my mother, she had a surgery and then she died, and then they told her that it was a blood infection.
Should I answer this question?
Yeah.
Yeah. Well, I am so sorry about your mother and what happened to her, but we do have some strategies in case an infection arises in your case. Okay.
Mm-hmm.
So what we do, we consider prophylactic antibiotics before the start of procedure, and even after the procedure, we take a very good care of your wound, and we take your vital to see if there is any sign of infection. And if we see if there is any infection after the surgery, then we consider some more antibiotics. Okay.
All right. Okay. That's good.
Are you with me?
Yeah.
Thanks.
That's
Thanks.
good answer. If after the surgery, if you are having any infection, so we will intervene at the right time. We can give you some antibiotic to treat the infection, and we will have a close eye on you. We will keep monitoring you for signs of infection. You can mention about vital sign. You can mention about blood test, and in this way, we will keep infection under control. Right?
Yeah.
Somebody is talking about bleeding. Sorry, there is a lot of disturbance. Okay, so if somebody has mentioned about bleeding, like, am I going to die with bleeding? So anybody who can answer me the same question? Anyone? Come on.
We could
Doctor,
we could start the
Yes, somebody was trying to answer. Yes, please.
continue, please. We could ask first that why do you think that, or why was that the first thing that came into your mind? First that question, and then we can like Dr. Asan did that first question, why did dying come to your mind immediately? We could ask that first.
And then, because doctor, you mentioned about bleeding,
and then we can explain. Okay, well, bleeding does happen in certain scenarios, but we'll be keeping a close eye on you. We'll be having all the products ready with us from blood it up.
Okay.
And we're also going to make sure that you have enough blood in your body as well. Okay, we'll be giving you fluids through your veins, and we'll be keeping a close eye on your observations. All right, we're not going to let you die with bleeding. Okay, I hope that helps alleviate the anxiety.
Yeah. So whenever you are addressing a concern, acknowledge the concern, then offer your, explanation, your reassurance, and then see if he or she is happy with your answer or not. And if he or she is not, then you can, explore that further. If he is happy or she is happy with your answer, then go ahead and talk about something else, right? So I think I need to start a new meeting now because this meeting is going to be finished and then we can talk about the rest of the station.